Imagine if somebody is in like their third year or final year and they want to consider like moving to the UK and practicing there. So how should they start?
One resource you cannot skip is PLAB.
What do you need to apply for the GMC registrations? Like what's the paperwork that goes through?
The UK salaries for junior. The good thing is when you apply for jobs, you don't pay anything.
Hi everybody, welcome to my channel. I am Dr. Rashi and I am here with Dr. Prachi who's been a friend of mine for years, and she's here to talk a little bit about her journey doing the PLAB and becoming a doctor in the UK. So yeah, welcome Prachi.
Hi Rashi, thanks for having me.
Oh, thank you for coming. Okay, cool. So do you want to start a little bit, like do you want to start with talking a little bit about, how his journey has been like and your timeline, and just talk about the introduction of PLAB for somebody who's hearing about it for the first time?
So when I started my journey, a lot of people didn't even know what PLAB was. So PLAB is basically an exam that you can give as an international medical graduate to practice in the UK. And it's a two-step exam, after which you get the license to practice in the UK, and following which you apply for training or non-training jobs and then practice in the UK.
Okay. So you just threw a lot of new words at me because I'm not very familiar with the terminologies either. So we'll talk about, start with talking about how does one start. So imagine if somebody is in like their third year or final year and they want to consider like moving to the UK and practicing there. So how should they start? Like what's their journey going to look like?
Yeah, so I think third year or the final year is actually the perfect time to start thinking about it. Not too soon, not too late. And you need to give your English proficiencies first. By that I mean the IELTS or the OET exam. It is just an exam that you give so that they know that you are well versed in English, and they've got certain criteria that you need to score above a certain threshold. And then once you give your IELTS or OET, you can actually apply on the GMC, which is General Medical Council, the Medical Council of UK, their website, and then you can make your own account, and that is how you apply for the PLAB 1 exam.
Okay. So we're on to PLAB 1, which is the first exam.
Yeah.
So could you just tell us a little bit about like what PLAB 1 entails, what subject it's covering, and what's the pattern and everything?
Right. So PLAB 1 is basically an exam that tests your knowledge as a medical graduate. It's not a very complicated exam. It is a multiple choice questions kind of pattern, and then objective pattern, and then you get five options for every question, and it includes 180 questions in 180 minutes. I would say the most difficult thing really about that exam is the time management, because the question stems are pretty long and they're all very clinical. And it includes mainly third year and final year MBBS. I'll talk about Indian so third year and final year subjects, and then a little bit of anatomy, a little bit of pharmac also. And they've got a very structured blueprint. The GMC has a very structured blueprint for PLAB 1, and the portion will not be anything outside of it. However, the questions can be framed differently, of course, every year.
Yes. And I see that even when I gave my step 1, I realized that even though they were testing like first and second year subjects, they were tested in very clinical and applied sort of a manner.
Yeah.
So I'm assuming it's very similar that.
Yes, it's very similar, and I don't know. I don't know how similar to USMLE though, but it is very applied and very clinical. And if you've got your concepts well, like solid concepts, and if you have a good understanding of the subject, I don't think it's a very difficult exam. Another thing about the exam is you just need to pass the exam. It is not a ranking based system. It's just a pass or fail exam. So you just have to clear the exam. And roughly the passing criteria is set around 125 to 130 marks out, like points out of 180. And it's a percentile based passing.
Okay, great. So could you just touch a little bit upon like what resources you used, and like looking back, do you think they worked well, or any resources that you discovered towards the end that you felt like were amazing?
Yeah, lots of them actually. So the most important and like the Bible, the holy grail of PLAB PLAB givers is PLABable. It's a 2000 questions based resource, and they've got their own notes as well. And that was definitely like you need to solve that twice. You need to do once all questions and then once the mocks. So that's amazing. But the resource I used was something called Med Revisions. So the Med Revisions notes are a little bit more elaborate. And although towards the end of my exam, I realized you did not need, like, I did not need to be reading that much elaborate stuff anyway. But I feel like it helped me. But the other resources that maximum people use is PLAB keys or PLAB verse. Although I did not use any of them, and I don't know how well they are, but they're in a very structured format and it helps a lot of people as well. But if there's one resource that you cannot skip, that is 100% PLABable.
Okay, great. So it's like doing your world for our steps. Yeah, I'll just weigh in on stuff that I have
because
done.
it's easier to then
Yes,
understand.
it's easier for everybody to understand because they're familiar. Maybe if they're familiar with USMLEs, makes sense.
One resource you cannot skip is PLABable. And then the other resources, it's up to you how much in detail you want to know or not, and also how much time you have. So MedRevision is quite extensive. By that I mean it has like 4,000 questions. So if you've got like 4 or 5 months in your hand, then yeah, you can do the first 2 months with MedRevisions. But if you've got like 2 months or 3 months, I wouldn't say you need to explore into so much detail. You just need to stick to one resource and be very thorough with it.
Got it. So now you gave your PLAB 1 and that was in India, right?
Yeah.
And what was next?
So I gave my PLAB 1 and then you have to go to the UK to give your PLAB 2. Naturally, you need a visa for that. So you can, there's a typical visa known as a PLAB 2 visa. So you can just apply for that and then you go for your PLAB 2s. The thing is, the exam is held in Manchester. But then the preparation for the exam can be done both online and it can be also done in the UK as well. So what people usually do is they join an academy. Now, I wouldn't say that you absolutely need an academy, but I would also say that it helps to have one. Although it does cost a little bit and maybe we can talk about it subsequently. But yeah, so you probably join an academy or you get help with someone and you start preparing for the PLAB 2. Now the PLAB 2 is an OSCE based exam. Would you want me to
Just tell us everything.
Yeah. So the PLAB 2 is structured in a way that there are 18 stations. Actually, there are 16 stations. What I mean by that, imagine a small room, when you've got a patient, you've got yourself as the doctor, and one person who's just your examiner who's observing you. So there are 18 rooms. 2 of them are rest stations. So you get like 8 minutes to rest for yourself.
Wow,
I think that's the best part about the exam. But yeah, coming back to the exam. You've got 16 stations. You need to pass, I think, 10 stations to clear the exams and also have a minimum score, which is again percentile based. And then you get 8 minutes to go in and then you're judged on your data gathering, which is your history taking examination, your management, which is your treatment, and then talking about the red flags or talking like just answering the patient's concerns really. Right. And then you are also judged on your interpersonal skills. That is the way you would interact with the patient and like if you're really solving their concerns. So you're judged on a total of 12 marks for each of these 3 domains. And you give the exam, you pass the exam, and then you're done with your PLAB 1 and PLAB 2. A little bit about preparing for PLAB 2 really. So what we do, what like academies do will be, they will give you a basic idea about how you need to take the history, because certain aspects of history taking are different than what we learn abroad, especially the social history or like talking about occupational therapists, physiotherapists. We don't use a lot of those terms or a lot of those facilities in our practice here. So they will give you a basic idea about that. They will tell you about the UK referral pathways, because they've got a different pathway. Like they've got general practice that is separate and hospitals that are separate. So you need to understand how the entire system works to give this exam. So they give you a basic overview, then you can practice with your colleagues, which is, I think, the most important takeaway from your PLAB 2 exam. You need to have a group of people who are in the same pathway, who are doing the same exam, who have got good understanding of the exam that you can practice with. And the more you practice, the better your exam is going to be.
Yes, I think that holds true for any like practical exam, that you can only sort of get better by doing it.
Yeah.
Like no matter of anybody teaching you or you reading about it is going to have the same impact as like stepping into it and actually just doing it.
Yeah, and you can read and read, but unless and until you speak it out loud and time yourself, because 8 minutes is not a lot of time to complete your consultation. But unless and until you keep practicing at it, you don't know how to manage your time that well.
So it just does take like a lot of preparation and a very dedicated sort of a preparation is what I'm hearing.
I mean, yeah, you can, I would say for a timeline, you can actually, if you're super dedicated and studying for like 8 to 10 hours a day, you should be able to clear your PLAB 2s in a month and a half or in 2 months. But it's always to have a bit more time. So I would suggest, like, if you're planning to go to the UK, have a basic idea of the exam, start practicing a little beforehand while you're still in your own home country, and then move to the country, practice over there. Because what happens is when you're in a new country, you understand their lifestyle better, you understand the way they talk in general, so that it helps you inculcate those practices and perform, like, do it in your exam as well. And you just get a basic idea, you get used to the system, and you can then give your exam and then you're done.
Oh, perfect. You're making it like sound so simple.
Oh, well, it is a very fun, like, I wouldn't say, if you take has got to do a lot with your nerves as well, because on the day of the exam, if you're nervous, it won't be the best for you. So I feel like once you think of it like a simple thing, or like you try to like fool your mind saying that it's not that tough, it's more enjoyable, it's going to be a great experience, and it will be. It is so perfectly timed, and it is such a good environment. Everybody's so friendly as well, that if you really think about enjoying it, you will do better in your exam, is what I feel. Also, everybody likes a confident doctor, right? You need to be able to calm your nerves down.
Yes. Definitely. So PLAB 1 done, PLAB 2 done. You are set. You've passed it. What
Yeah.
what do you do next?
So what I did next was I did a clinical attachment. Now, clinical attachments in the UK, I believe, are quite different than the attachments or observerships you would do in the US, but I'm not too sure about that either.
Sure, just like
But
tell me about
yeah,
it.
it's not necessary to do an attachment. The only reason people usually do is to get some experience of the kind of healthcare system NHS is, and you get to make some connections out of it. And for the attachments, you basically just send out emails to consultants asking them to supervise you, and then you go there. People usually for like 4 weeks. I think 4 weeks is enough. And the way like most people do it, they would do it before the GMC registration. So technically, you cannot like perform procedures, or you cannot do anything. You can, however, I do believe, and people also say that it helps you get a non-training job easier, which is something I'll talk about next. But it's not necessary to do a clinical attachment. If you feel like it's too much money, you shouldn't do like, I wouldn't say
Do
that.
you have to pay for these things?
Sometimes yes, but most clinical attachments are free. You just pay a little bit for the occupational health or like the paperwork. But there are paid attachments as well.
Okay, cool. So like your main goal out of this is that either building connections and just getting experience. Do you have to get like some sort of letters of recommendations, because that is something that we do in the USMLE pathway. So do you do that as well?
So earlier I used to believe letters of recommendation hold a lot of value, but honestly it's the references and the emails that hold a lot of value. So when you apply for jobs or when you apply for training, they usually send references to people from the last 3 years, the places you've worked at, or if you had any gaps, then somebody who can provide a reference for you. And in the reference itself, they will ask us a couple of questions, and they have to just write down what they feel. It's not a particular letter that's important, but what that person thinks of you in that moment. And so if you do an attachment, you need to put in like a good impression, and you need to be memorable to them. You need to take the steps to be memorable. Another thing that's very like good about a clinical attachment would be it gives you an opportunity to attend different parts of clinical governance. Like you can participate in audits, you can participate in some sort of research. You can also attend like morbidity mortality meetings or team meetings. So I think that's a very good aspect of the healthcare that you understand. And You also understand how it really works, the hospitals, because they are quite different. Their documentation procedures are different. They've got different webs, like softwares. So all of that really gives you a good idea of the hospital system that you are eventually going to work through.
Yeah, I think it's a great like snapshot into eventually the life that you would be living. And by the way you're talking about it, I feel like, if you do get an opportunity, and if you have the time, you should definitely like maybe give it a shot and see.
Yeah, 100%. And it is so nice to see the way it works, right? In fact, one thing I thought was you can probably do a clinical attachment even before your PLAB 2, because PLAB 2 tests something that's very similar to the hospital system. So it would give you a better idea. But the only reason people don't do it, because before an exam, if you're spending 9 to 4 in a hospital, you won't get that time to study.
Yeah.
But if you've got like 3 months before your exam, then that is something also people can try.
That is, I have never heard of that. Like I never thought of it that way. But now that I think of it, I think because I did my electives,
Yeah.
like step 2 is not a OSCE, but because I did my electives in the US before I gave my step 2, I had a great insight into their system.
Yeah.
Because it already been there for a few months. I knew how it works. I know the way people talk, those like ethics based questions, and those like the way the system works is just very familiar. And I think had I given it just like after my step 1,
Yeah.
it would have been a little bit like more challenging.
Yeah, exactly. The part about like the ethical and the counseling based part, and even the procedures, like in your PLAB 2 exam, you might also have like procedural based
Wow.
OSCEs. So the procedures they would do also, like all of those practices when you get to see firsthand, I think it's a very good idea to do it before your PLAB 2. Like if I had to do it all over again, I would probably go that road. But not having done it myself, I don't know if I can really say that to people.
No. I'm sure you can, because I think in retrospect we can always think of, oh, I could have done this a little bit better.
Yeah, and retrospectively you get to understand so many other things as well. So clinical attachments would, like at PLAB 2, you've done your PLAB 2, you passed your PLAB 2, you get to celebrate as well. And if you're doing an attachment, great. If you're not doing an attachment, another thing you can do before you come back would be doing an ALS, Advanced Life Support. So you know how American Heart Association has ACLS,
Yeah.
and I think it's very widely available here as well. But the ALS is by Research Council UK, and it's not really like, I tried to find a lot of ALS courses in India. The only ones I could find were by the European Council, which is also acceptable. But then while you're there, you can do your ALS because it really helps you build your portfolio, and it's a very good skill to have. And also, although ACLS and ALS are almost similar, but the Research Council UK accepts the Research Council UK's ALS protocols.
Okay.
So that's another thing you can do while in the UK. And then you can apply for your GMC registration, which is the thing that we were aiming for when we started on this PLAB pathway, right? So then you apply for your GMC registration.
Okay, so you just have to like, could you just talk a little bit about what do you need to apply for the GMC registrations? Like what's the paperwork that goes through?
Yeah.
And then once you're registered, what happens? Like what does GMC registration really give you after?
Okay, so it's a very straightforward process. One thing you need is you need your degree verified by EPIC. So there's a thing called as EPIC verification. So if you want to save on your time, you can get your EPIC verification done after your PLAB 1, which is when most people do it. If you've not done it, then do it as soon as soon as you can. So you need your EPIC verification. The other thing you need is I forgot.
It's okay. What do you
It's
need?
called some certificate.
Good standing certificate.
Yes, a certificate of good standing.
By your medical council.
Yes. So the other thing you would need is a certificate of good standing. The thing is, the CGS is valid only for 3 months. So this is something you cannot do beforehand, but you should apply for it as soon as you get your PLAB 2 results, or if you're very sure, just as soon as you're done with your PLAB 2, you can apply for it. And I think you can get it within 2 weeks or lesser. And once you've got these documents, you can pretty much apply for your GMC registration, and they will send you a list of other documents that they need. It's usually like passports. If you've worked anywhere without like your registration in your own country, or like for a period of time without your provisional registration, or if you work in some other place, other state or so, you might require something known as a Gen 1 form to be signed. And since COVID, they sometimes also ask for like if you had any distant period of distant learning and what did that entail, just to get an idea of how your education was. Very straightforward. They will email you a list of documents. You can arrange it in a couple of days and apply for your registration.
Okay, registration done.
Done, yeah. It takes less than a month. Like GMC really tries that they give you your registration within a month. So if you are very much on your timeline, you can have your registration within a month of passing your PLAB 2s, which is excellent. And to answer your other question, what does the registration give you? It gives you the license to practice in the UK. You can also get only have your GMC registration, and you can renew your license later on if you're not immediately planning to go to the UK.
Okay.
Or you can use a license for the first year. You need to revalidate it after every year and have your things done.
So now you've registered with the GMC, it's all done. Next, you will apply for a job.
Yeah, so honestly, the PLAB exams give you registration. The PLAB exams do not give you a job. And once you get your registration, that is not where most people's journeys would end. Like, there could be some instances where people just want a registration. But then for most people who decide on the PLAB path when immediately after their final year, they want to start their residency or training, as they call it in the UK. So your residency is known as your training, and then your jobs that I keep mentioning is your non-training.
Okay.
So it's like you're working a job to get to know the system better, and then you can apply for your training subsequently. So for that, now this is where the pathways kind of differentiate, like if you want to get into training immediately or if you want to do a non-training first. The advice I have gotten from most people is to do a non-training first, because directly getting into training can be overwhelming at times. You don't know how the things work. And plus the non-training will give you a chance to build your portfolio as well.
Could you just walk me through what the entire training pathway would look like? For example, I'll just like talk about the US, that you do your MD, sort of like your postgraduate degree, that's like 3 years or 4 years, 5 years, 6 years, and then you do your fellowships, which is again like 1, 2 or 3 years.
Yeah.
So that's how you become like a consultant, basically, like a specialist.
Kind of like a 7-year thing,
Yeah,
right?
like it depends on the specialty.
Yeah.
So could you give me like a parallel of that in the UK?
Yes. So UK training is also again almost 7 to 8 years, depending on the specialty. The thing is, their internship is 2 years, so it's called foundation years. So our like Indian internship, which is 1 year, is equivalent to their foundation year 1.
Okay.
And then if you're immediately applying, then you can apply to the foundation year 2, which is their second round of internship. And otherwise, the main training, the residency that we would say, it starts with something such as a core training or a specialty training. So you do your core training year 1 and core training year 2 for core specialties like medicine and surgery. And then for some certain specialties that start immediately for the first year, like cardiothoracic maybe, you do your specialty training 1, specialty training 2. And then after that, you go into like you reach the registrar level and you do a middle grade jobs. So that would be like core training, specialty training 3, 4, 5, 6, 7. So again, like 5 years of like specialization. And then I think it is up to CT 8. It can go up to 8 years or total. And then after that, you complete your training and you be practice as a consultant.
Perfect. Also, that's
It's quite similar, I think.
It is quite similar. I think it's the terminology that takes a little bit of time to just sink in.
Yeah, I think the terminology throws a lot of people off because they think 8 years of training, that's a lot. But I feel like if you compare it with anywhere else, to be like a specialist in your field, most countries will have like a 7 or 8 year pathway overall.
True.
And I guess 1 or 2 years more or less doesn't make a difference.
Yeah. We're studying for like 10, 15, so I guess 17 wouldn't make a difference.
Yeah, probably.
Just... Okay, so we've talked about the timeline. What else do you want to talk about?
Well, about the timeline, I would like to talk about the job application part, to be very honest, because the one big myth or a misconception I had, or a mistake I made, honestly, was like I got my GMC registration and I became super relaxed, thinking that I'd finally done everything that I wanted to do. But the reality was, although I had a license to practice now, I did not have a place to practice. Right? It makes sense. So then I decided to do non-training because I wanted to gain more experience before I enter my training. Because once you enter your training, it's like a commitment for a longer period of time, and you want to do it from the best place possible. So you need to build your portfolio. Not saying you need to build your portfolio in the UK itself. You can build it beforehand as well. Of course, you can. Your CV keeps on building all the time. Everything you do is your CV. But so I started applying. So there are several sites that you can apply on. So for England, there are two main, England and Wales. There are two main places called NHS Jobs and Track Jobs. And then for Scotland, you've got NHS Scotland, and Northern Ireland has their own website as well. So on these four platforms, you can apply for non-training jobs, which is basically just a job that you're applying to. And then every year in October, they open up the training, like the website that they open up training on is called Oriel. So to enter training, you need to get a form signed called as the CREST form, CREST. It is basically a certificate of readiness to enter specialty training, and you can get it signed by any consultant you've worked under for a period of 3 months or more. And it's got certain checklist. Of course, you need to do those, and then you get your CREST form signed, and you can apply for training in October. And then you give, for certain specialties you give exams, for certain specialties you have a portfolio based scoring, certain specialty you have all of it together, and then interviews probably. And then finally in August of next year is when you start your training.
Okay, so almost a year between you applying and you finally like starting a training.
Yeah, so because it's like, I would say it's quite equivalent to the match because it's a lot of steps. Like for psychiatry or GP, general practice, you would give an exam in January. For surgical specialties, you need to give the exam as well as your portfolio. And then for internal medicine, which is IMT training, for IMT, you are scored on your portfolio and your interview. So all of those steps take time.
Yes.
The interviews take a lot of time. Your matching takes a lot of time. So it takes almost a year. So it really works well to plan this quite in advance. Like if I want to start training by August 2025, this October 2024, I need to have all of my paperwork, all of my portfolio built. And then there's a smaller round of training in February as well. That is for the vacancies of August. But most people aim for the August pathway naturally.
Because it's a bigger chunk of jobs that are available, and that's the main sort of a thing. Okay, wow. And like just to give like us an idea, if like you were to do internal medicine and then say become a cardiologist, what would you do? So you would do your foundation year 2.
Yes.
Then you would enter internal medicine training.
Yes.
And you would have to like give an exam in between them. Like how would you just do the transition?
Yeah. So foundation year 2 is not compulsory. Like if you already have your CREST signed and if you've got 2 years of work experience, which I believe by the time you're doing your PLAB 1, PLAB 2, all of it, you end up getting more experience than your internship. So you can directly enter the core training as well. So for IMT, you don't need to give an exam to enter medicine training. You need a strong portfolio. There's a self-scoring system which is widely available on the internet, and then you can score, like you can build your portfolio based on that scoring system, and then you give interviews, and then you're ranked on based of that interviews, and then based on your rank you are assigned a deanery. A deanery is basically a group of hospitals and trusts in a particular region, and then you rotate through that region throughout your training.
Okay.
Yeah. And then for your specialty, like you give your CT1 and CT2, you do it from that deanery. And for your specialty training, again, you enter, like for your ST3, you go through a similar pathway again. And then you get into the deanery and then you do your STs.
Okay, understood. Now
So for a cardiologist, they would get into a cardiology training at the ST3 level.
Perfect. Understood.
Yeah.
What else? Could you like talk a little bit about what is the compensation like in the UK? Like how much do you expect to earn when you're like starting your first job, and then as you climb through, what do you expect?
Yeah. So the UK salaries for junior doctor, like until you're a consultant, you're always a junior doctor in the UK. So for junior doctors, it varies and of course increases every year. But then if you start at a FY2 level, it would be somewhere around, like the basic wages I'm talking about, it would be somewhere around 37,000 pounds, which would translate to 37 lakhs in Indian rupee. Well, the cost of living is higher too, right? But yeah. So for FY1, it would be slightly less, and then for FY2, it is 37,000 pounds. And then if you start at a core training level or so, you start at around 43,000 pounds. And then I think, I'm not too sure, but I think as you go on up to the ST6 or ST7, ST8 level, it goes up to 78,000 pounds. And then a consultant, once you're a consultant, you earn between 80 to 90,000 pounds to 100,000 pounds. And it increases after, of course, with your experience.
Yeah, and these are all like basic. This is the basic salary, right?
This is the basic salary, and then if you work more hours, if you work weekends, if you work nights, you're of course paid like a higher wage. Like your per hour wages increase a little bit more, and if you like depending on the work that you do, the like if you're in a busy specialty, if you're in like an emergency medicine or so, where you are going to put in more than 40 hours a week, you would get paid more. If you're in a specialty with lesser on calls or lesser, like if you've got a 1 in 16 rota where you're doing weekends for some specialty like psychiatry, your wages would subsequently like differ.
You are just paid for the work you do, like the hours that you put in.
Yes.
About the PLAB journey, like since these are like, this is the compensation you'll get, what is the investment that you've put in terms of money, if you're comfortable talking about it, and like what stage you spent how much money?
So the expenses for the journey were, it's again very subjective, but some expenses are always going to be there. So my IELTS exam was, I think it was 17,000 rupees. And if you give an OET, it is 34,000 rupees. So that's the first expense. Then you give your PLABable subscription is like 4,000 rupees for 3 months. So that's like not that expensive. Honestly, it's very cheap. I found it to be very cheap when I compared it with the tuitions I would have done here in India anyway.
And if you compare it to UL, that is incredibly cheap.
Yeah, well, if you compare it to US, you're gonna feel UK is super cheap when it comes to exams.
For the process, yes. Because I just paid like a small fortune for my UL subscription just like yesterday, and I'm like, oh no. I'm like, okay, this is the last UL subscription I paid for my step 3. So like this is the last subscription I'm paying for. It's very expensive.
I found that was actually very shocking to me as well when I saw like PLABable was 4,000 rupees, and then for a small like a small fee you can get their gem. It's something called PLABable Gems, which was amazing. And then I also took med revision, so that was another 6,000 or something. So you'll do the math later, right?
Yeah. We're not good at math, that's why we picked this.
True. So then I gave my PLAB 1 exam. So that was 23,000 rupees or 230 pounds. Then came PLAB 2. PLAB 2 was a bit more expensive naturally. I had to fly to UK, and like I would talk about all the expenses. The exam in general also costs around 90,000 rupees or like 900 pounds. And then my tickets at that point, they were pretty expensive. So depending on the time of the year, but I would say still they would be like around 70,000 rupees if you're flying from India. And then your visa, if you don't take a priority visa, which I did not take, I took a standard visa, it was around 9,000. But I also had some, like I had to fly out for my visa and stuff, so came to around 15,000 rupees. And then your accommodation in the UK, your academies in the UK. So academies charge you around 600 pounds. If you have a group of people, they will give you a £100 discount, but still 600 pounds for the academy. Living in the UK, if you're sharing a room, assume, or like I said, £1,000 for your accommodation, 500 pounds for your day-to-day expenses for a month, and you would be staying for 2 months. So I would say like over 3,000 pounds or 3 lakh rupees for your stay in the UK for 2 months. And well, if you do an attachment, you can just increase it for 1 more month again. And that's it. You have to pay a small fee for your EPIC and GMC registration. I think it comes around to again something 30,000 rupees or so on an average. But despite all of these expenses, and when I talk about my accommodation and stay in the UK, I'm talking about the higher side of it. But after all of these expenses, I feel like my entire PLAB pathway costed me around 7 to 8 lakh rupees. Apart from the expenses I did like my traveling expenses on, they were definitely maybe a bit more, but you can very well do it very comfortably in around 7 to 8 lakh rupees or 7,000 pounds.
That's amazing. I think it's a very like great general idea for somebody who's just maybe thinking about doing it, so that they can plan ahead. They can, save up and plan their finances in a way that it will be available when it's needed. Because as I see that PLAB 2 is like quite an expensive affair. So like if you're applying for it and that, so you'll have to like save up thoda sa before you do that.
Yeah, because you need the basic thing is people go over there for a month and a half minimum, and you wouldn't want to like you need to prepare for it well. Although you can avoid it altogether and still pass the exam, but I feel like you would rather be a bit more safer by going. So you need to prepare for those expenses.
Like pros and cons, okay? Like you can cut corners. Like yeah, you can just like save up on these expenses if
Eat
you
home cooked food every day. You save a lot of money as it is, right?
Yeah. Don't drink coffee outside. Not speaking from personal experience.
Speaking from personal experience, don't. But yeah, the good thing is when you apply for jobs, you don't pay anything.
Okay.
When you get into training, there's no fee to get into training. I'm not sure if they might ask for like a minimal fee or so. But yeah, like once you're done with your GMC registration, the only other expense you would then pay for is your flight tickets, your visa,
one-way ticket to the UK.
your one-way ticket to the UK. I guess that's worth it any day. And your visa. And apart from that, maybe your first month expenses while you wait for your salary, those. But apart from that, onwards, like there on forth, you will not have many expenses, or so I hope, to be very honest.
No. It makes complete sense. Like I think this is a great like overview of what anybody should expect.
I think I've read somewhere, I don't know myself either, but I've read somewhere every year when you give an exam to get into like the next 3 year of training or so, you end up spending 500-600 pounds, and then you have to naturally spend on like courses and stuff. So, but I don't know if we should count that in the PLAB expenses, but some expenses will always be there that you cannot do anything
Yeah,
about.
like the fee you pay to keep up your registrations and your exams, and yeah, I don't think those are like PLAB expenses. I think once you move there, they are just like UK expenses.
Yeah, and you need to pay those fees. Like you don't have an out of that. So
True. Now you're going to come back here and tell us next year on what those expenses are.
now, yeah, I will come back next year and tell you how right or wrong I was in about the cost of living, the salaries, whether or not they were enough, all of those things.
No. This was like extremely helpful. Do you just have like some rapid, like small bits of advice for anybody who's like considering doing this? And
Yeah, actually, I might have a few.
Okay,
The first one would be start building your CVs. They value a lot of things that you've done outside of your normal day-to-day medical education. So you can do like leadership activities, be a part of like different what do you call it?
college committees,
Yeah, like be a
councils.
part of college councils, college committees. Try to be more enthusiastic about those. You can do team activities, sports. Like try to do those. Research, definitely research is always there. But the other thing that felt they value a lot in the NHS is a clinical audit. So you need to like read upon what an audit is and do it, and it's not that tough. It's quite faster, quite easier than doing a research as well. But yeah, having both helps more. And once you have like an audit or a research, I think you can build upon the same aspect by presenting it, by publishing it in a good PubMed indexed or like a well-known journal. So it adds a lot more credibility, and definitely like presenting it in conferences. I think that's very important. So if you are a third year student or if you're a final year student and you're thinking about giving the PLAB pathway, you should definitely start building your CV slowly and gradually. If you're very sure about the kind of specialty you want to get into, you should look upon the requirements of their training pathway, like when you get into the training. So for example, radiology, for the radiology aspirants, they've got a very specific set of scoring criteria where you get more points if your CV is radiology specific.
Okay.
Yeah. So like if you've done a research in radiology or you do a presentation in radiology, you'll probably get 5 points. But if you do a research in any other subject, you'll probably get like 2 or 3 points. So it's always better to score higher. You get a better deanery. Similarly for internal medicine. So you can look upon that earlier the better and like focus on it. And the other thing is, throughout this journey, you meet a lot of people. Like for your PLAB one also, you will find like groups and stuff where people are discussing questions or they're like solving each other's doubts. It helps to recall. And especially for your PLAB 2, I wouldn't say you need somebody to practice with, but it always helps to have another person you're practicing with. So try to make your friends. And even when you apply for like jobs, because applying for non-training jobs can be very exhausting at times, so having people really helps. So those are my top two things, like build on your CV, do your life support courses, do your audits, and have like people who are in the same path of the journey, so that it makes it easier for you to go through it.
Right. No, I completely agree. I think picking on these journeys which are a little unconventional, as to say, for like where we're coming from, I think it's so much nicer to do it with somebody if you have friends, and just a good solid support system of people that understand what it entails, what you're going through is that's invaluable.
100%. Also because these are essentially a bit time consuming journeys. So when you finish your med school, when you're done with your internship or so, and then you see all of your friends who, not like, majority of them will not like go upon these like you said, unconventional pathways. So you see them settling down, they are getting into their residencies, and you're probably still giving your exams, or you're still struggling with your matching or your non-training training. And at that point of time, you need to have a very strong mindset. And it's not always that you will be very strong on your own, because the resilience also ebbs and flows. So it helps to have somebody who's understanding what you are too.
No, completely agree. And I think throughout even my journey, what I feel the most grateful about is the people that I've met and the friends that I've made. So yeah, I think it just applies everywhere.
Yeah, I mean, when I was applying for my applications also, I would contact people who were already working. I'd be like, could you just like read through it, tell me something, or like I would just call a friend of mine and be like, it's getting very tough. So at one point she was like, I just do this one thing. I would apply for 2 jobs before I go to sleep, and I would not sleep before that. And I started applying her advice to my practice, and it helped me. So having some sort of support also, because like what I experienced was my parents or my friends, although they wanted to really help me, they couldn't completely understand how to help me. They didn't know anything about the pathway. Even when practicing for the exam, they weren't so oriented with the ethical or the the different parts, like history taking or management. Still people can help you with, but the other small aspects of the
like the preventative things and stuff that they will grade you on, basically. Right, you need to score those 4.
Yes. So those things, I realized that although there were so many people who would be willing to help you, but it's out of their area of expertise to help you anyway. So just having people along really helps.
Nice. Yep, cool. So thank you so much for watching. Prachi is like going into her first job in the UK super soon. So I'm like so grateful and thankful that you could like manage to come and do this. So and I really hope that anybody who's planning to go on this journey, this gives you some insight onto what the journey looks like, and hopefully you can make a decision sooner. And if you have any more questions, leave them in the comments, and I'll try to like talk to her and answer them. And maybe we'll do a part 2 maybe next year when Prachi is in the UK.
Yeah, maybe I can tell a bit more in detail about certain things.
I think we'll need to do a part 2 where you talk about like more about the life in UK and things.
I could talk about that, I guess.
Yeah, and like give us an insider perspective on working in the NHS.
Yeah, maybe well, you'll have to video call me from probably US at that point of time.
Hopefully. Okay, cool. Okay, then thank you so much.
Thank you for having me.
Thank you so much for watching. Bye.